Sleep is often thought of as a passive state where the body simply rests. But in reality, it is an active and deeply restorative process during which the heart, blood vessels, brain, and hormones undergo critical repair and regulation. And what many people do not realize is that not only the duration and quality of sleep matter for heart health, but even the position in which you sleep may influence circulation, breathing efficiency, blood pressure patterns, and cardiac workload. The heart works continuously, beating over 100,000 times a day. And during sleep, it finally gets a chance to slow down, reduce blood pressure, and recover from daytime stress. Yet certain sleep positions can either support or slightly challenge this recovery process depending on an individual's health condition. For example, sleeping on the left side is often discussed in relation to heart health because anatomically the heart sits slightly toward the left side of the chest, and when lying on the left, gravity may influence how the heart rests within the chest cavity. And some individuals with heart failure report increased awareness of their heartbeat or mild discomfort in this position, while others find it improves circulation and reduces acid reflux, which indirectly benefits heart health by improving sleep quality. Sleeping on the right side may feel more comfortable for some cardiac patients because it can reduce pressure sensation over the heart area, and for individuals with certain structural heart conditions, this position may decrease awareness of palpitations. Back sleeping, while common, can sometimes worsen snoring and obstructive sleep apnea in susceptible individuals. And sleep apnea is a major cardiovascular risk factor because repeated pauses in breathing cause drops in oxygen levels, surges in blood pressure, and stress hormone spikes throughout the night, significantly increasing the risk of hypertension, arrhythmias, heart attack, and stroke. Stomach. Sleeping, although comfortable for some, may strain the neck and interfere with optimal breathing patterns, potentially reducing oxygen intake during deep sleep stages. Beyond position alone, the most critical factor is how well breathing is maintained during sleep, because oxygen is essential for heart muscle recovery. And interrupted breathing creates repeated stress responses that prevent the heart from entering its natural low-pressure restorative phase. Blood pressure normally dips at night in healthy individuals, a phenomenon known as nocturnal dipping, and failure of blood pressure to dip adequately is associated with higher cardiovascular risk and poor sleep quality. Discomfort from improper positioning or sleep apnea can interfere with this protective dipping pattern. Circulation also changes depending on posture, as gravity influences venous return, fluid distribution, and cardiac filling pressures, and individuals with heart failure may notice increased breathlessness when lying flat because fluid redistributes toward the lungs, a condition known as orthopnea, which is why elevating the head slightly with pillows or an adjustable bed can improve breathing comfort and reduce nighttime strain on the heart. Acid reflux is another factor linking sleep position to heart health. Since reflux symptoms can mimic chest pain and disturb sleep, increasing stress and blood pressure, and left-side sleeping has been shown in many cases to reduce reflux episodes compared to right-side sleeping. Heart rhythm stability is also connected to sleep quality because deep sleep stages help regulate autonomic balance, enhancing parasympathetic tone which slows heart rate and stabilizes rhythm, whereas fragmented sleep maintains sympathetic dominance, increasing the likelihood of palpitations and irregular beats. Beyond mechanical and physiological aspects, sleep position affects musculoskeletal comfort, and chronic discomfort can lead to repeated awakenings that prevent restorative sleep cycles, indirectly increasing cardiovascular strain. Individuals recovering from cardiac surgery must pay particular attention to sleeping posture because chest incision healing, sternal stability, and breathing comfort are essential, and often semi-reclined positions are recommended in early recovery to reduce pressure and improve lung expansion. Choosing the right pillow height, mattress firmness, and sleep environment plays a supportive role in Maintaining neutral spinal alignment and unrestricted breathing, temperature, noise levels, and light exposure also influence sleep depth and hormonal regulation, including melatonin secretion, which indirectly supports cardiovascular health. Chronic sleep deprivation, regardless of position, increases cortisol levels, raises blood pressure, impairs glucose metabolism, increases appetite for unhealthy foods, and promotes inflammation, all of which significantly elevate heart disease risk. Research consistently shows that individuals sleeping fewer than 6 hours per night have higher rates of coronary artery disease and stroke compared to those achieving 7 to 8 hours of quality sleep. Therefore, while sleep position alone is not the sole determinant of heart health, it interacts with breathing patterns, comfort, oxygenation, reflux, and blood pressure regulation, making it an important consideration especially for people with existing cardiovascular conditions. Practical advice includes experimenting with side sleeping if back sleeping worsens snoring, using supportive pillows to maintain alignment, elevating the head slightly if experiencing breathlessness, seeking evaluation for sleep apnea if loud snoring, daytime fatigue, or witnessed breathing pauses occur, maintaining a consistent sleep schedule, limiting caffeine and heavy meals before bedtime, engaging in calming bedtime routines to reduce stress hormones, and ensuring the sleep environment promotes deep uninterrupted rest. Ultimately, the heart thrives when it receives consistent oxygen, stable blood pressure patterns, reduced nighttime stress hormones, and adequate restorative sleep cycles. And while no single sleep position guarantees perfect heart health, mindful adjustments combined with healthy lifestyle habits such as balanced nutrition, regular exercise, stress management, and routine medical checkups create a comprehensive approach to protecting cardiovascular function. Understanding that even seemingly small habits like how we lie down each night can influence overall well-being empowers individuals to take proactive steps toward long-term heart protection. Because prevention is often built on daily details, and when sleep becomes intentional, restorative, and supportive of breathing and circulation, the heart benefits silently but profoundly over time.